Welcome to CCM 135 Communications. My name is Mr. Monclova, and I'm going to be your instructor for this section. Today we're going to cover Chapter 7 on cultural sensitivity. Please feel free to pause this PowerPoint at any point in time to take a look over the course objectives, as we're going to cover these through this section today. Immigration and birth patterns are changing rapidly in the United States. So in 2015, according to the Census Bureau, we saw that the population of the United States was broken down into percentages. And so we saw that 60%, 62% of the United States was comprised of non-Latino white Americans, and then just over 18% were Latino, almost 12% in African American population, and then just over 5% of the Asian population. As time goes on, we're going to see a shift in these cultural and ethnic backgrounds. So by 2045, by the same Census Bureau, we're going to see that Latino and Asian populations should increase by nearly 28 and 60% respectively. The African American population should grow to about 10%, and then non-Latino white populations will become a much smaller segment, which will be about 49% of the total U.S. population. As a healthcare provider, we have to develop an understanding of cultural sensitivity. We also call this cultural competence, and we use this to work effectively with our patients and coworkers. It's become clear that cultural competence is extremely important, and it's probably the most important competency to learn. And we use these competency traits in physical therapy when working with our patients or when we work with other healthcare providers. There is significant documented evidence that indicates that racial and ethnic minorities receive lower quality and poor access to health care. So these individuals can have cardiovascular disease, cancer, and HIV, and are usually left untreated or poorly managed. And when that happens, it usually results in poor patient outcomes. There was a survey done by the Kaiser Family Foundation in 2016 that 48% of non-elderly African Americans delayed or did not seek access to health care, and 52% of Latinos were delayed or did not seek health care as well. And we do often see that with minorities, there is a socioeconomic component to this, and we find that when certain cultural backgrounds or ethnic backgrounds have a lower socioeconomic status, they tend to not seek health care as readily as those who have a high socioeconomic status. So there are correlations related to healthcare and socioeconomic status.